Okay, I can see that people are still joining, but because we have a lot of things to cover this morning, I would like to start. So good morning, good afternoon, and good evening, everyone. Welcome to our monthly regular course community learning and knowledge sharing session. As many of you know, my name is Elena Fadeeva, and I am team lead for the course community team in OPCS. It is hard to believe that today we complete a full year of delivering course community learning and knowledge sharing sessions. Those of you who joined our first event in July last year may remember that the conversation was about improving assessment of the risks to development outcomes. Today we will focus on development outcomes again, but on another aspect, namely outcome orientation. As you may have noticed, this combination of words is becoming quite trendy in the World Bank. So what exactly is outcome orientation? Some may define it as an ability to generate feedback on what works, what does not, and why, and to use this feedback to adapt country programs in a way to boost contribution to development outcomes. As always, we want this session to be highly interactive, so please ask your questions in the chat, do not be shy, and we will try to answer most of them either during this hour or as a follow-up. Just a reminder before you leave, because I know some people may leave earlier, please take our brief survey to let us know how we're doing and what you think of today's session. We have a lot of information, as mentioned, to share with you. So without any further delay, let me introduce our distinguished moderator, Lisandro Martin, manager in the results unit in OPCS. Lisandro, over to you.
Thank you very much, Helena, and good morning, good afternoon, colleagues. Very nice to participate in this last event of the year for the COS community. Moderating this important discussion about outcome orientation. I see in the list of participants, we have people from many different and interesting units and places, including IEG and operations. So I hope it will be a useful conversation. What we will do today is not so much talk about outcome orientation in abstract or conceptually, but go directly into some of the experiences that our colleagues in the field have in undertaking what we call the outcome pilots. These were exercises that were, in a way coordinated by OPCS, but fully driven by the different country teams in order to understand ways in which the bank contributes to outcomes and articulate outcomes. You might have heard already several conversations that we had with you in different fora about the interest of shareholders, the interest of the board, the interest of IEG, of management, in putting together a plan to strengthen the outcome orientation of the bank, of the World Bank Group in general. And this is really, there is a motivation behind that, where we think that there is a big opportunity for the World Bank Group to tell a more comprehensive story of the results that it achieves. When we look at our documentation and usually at the way we internally talk about results, we focus very much on what we call the direct pathways, the results that are achieved directly with our investments, particularly on service delivery, on infrastructure, on things that are very tangible and we can quantify. But those of you that interact with the clients daily will probably understand better that when you talk to government about what they think are the bank's greatest contributions to their countries, they don't mention those things necessarily. They talk about contributions in paradigm shifts, in analytical ideas, in new ways of thinking, and that is not necessarily always very well captured in the way that we report on results. So around a year or a bit more than a year ago, OPCS decided to work with some of the CMUs to pilot this different way of trying to measure the way we achieve results, and undertook different pilots concentrated on very concrete outcomes and trying to apply a methodology that is called contribution analysis. That it's about trying to use many different sources of evidence to understand the way the bank contributed to a result that, that has a long-term horizon. In fact, in many of the, if not in all of the pilots that we will discuss today, we took a 20-year horizon. We interviewed very many different stakeholders. We reviewed evidence. We produced data to try to understand how the bank, together with other development partners in the different country contexts, contributed to those very long-term results through a combination of all the different instruments, lending and non-lending instruments. So this helped us. Undertaking these pilots helped us to draw important lessons so that we can adapt our CPF guidance to really do that, measure outcomes on the long term. IG has been a very important contributor to this discussion. You probably participated in one or many of the several conversations that IG has led with staff or read the evaluation of country outcomes, of outcome orientation at the country level, where they very much share our own conclusion after undertaking these pilots, which is that, the way in which the bank aims for outcomes is quite sound, and teams understand the outcomes that they aim to, but there are opportunities to better articulate those outcomes and measure those outcomes in our result systems at the country level. So we have learned from these pilots, we have learned from IG, and we are putting together in OPCS revised guidance for CPF that allows us to move the needle of our result systems from measuring outputs and intermediate results to more longer-term outcomes. So this is the framing of this discussion, and what I will do now is really give the rest of the time to the presenters, to the people that know more than me what we are talking about and the practicalities of undertaking this approach. And then we will open it for a discussion for questions, answers that you might have about their experiences. We have with us three distinguished colleagues today: Livia Benavides, who is the program leader in human development, and she was involved in the Peru pilot; Tassin Fassi, lead economist in education and was involved in the Pakistan pilot; Zubair Sadek, senior energy specialist in Africa and was involved in the Kenya pilot. Good to see you, Zubair. It's been a while. So let me now start with Livia and ask Livia if she can, start this discussion by telling us a little bit about the Peru pilot. What were the goals of the pilot and what were some of the key findings along the way? Livia, over to you.
Okay, thank you, Lisandro, and it's very nice to be participating in these COS events. So the idea was really to understand what were the main factors that were linked to the issue of very high malnutrition in Peru. And the fact is that, this issue of aligning the line of sight to an indicator that we were very, very much aware that existed, but how was it that we were able to really achieve, the reduction in the indicator? Okay, and to me, that was the big question that we asked when we did the interventions, and then when the pilot study was carried out, was really trying to sort of disaggregate that a little bit and try to find out if there was attribution, let's say, to the bank's contribution, especially through these indirect pathways. So from that point of view, so a couple of facts, okay? Peru was doing very badly in terms of malnutrition. The bank was very much aware of it. There were very many partners who were aware of it. And I think that a huge factor towards the success of this was bringing all of these partners together upon the demand of the government. And I would really like to underline the demand from government to align ourselves so that we could all work from that point of view. And I think that the interesting part of the pilot study that was carried out by COS was really, trying to dig into all of the work that we had done and really try to find out, what were the lessons learned. And to me, among the lessons learned is this issue of direct versus indirect pathways. I think it's extremely important. The other one is keeping a line of sight over CPF cycles. And the other one, to me, is that, government demand is extremely important. And I think that the pilot study showed that. One of the things that we did, and I would really like to have some publicity here, is that, we as a bank group, realizing that, we very seldom communicate all of this work, we produced a book that is more on a journalistic style, but trying to really, bring out some of these messages that can be read by many people and not just by the scientific community. And the book is called Standing Tall, and I can share the link to the book that was produced by the team at that point. Thank you, Lisandro.
Thank you very much, Livia, for the introduction. And let me go to Tassim now to talk about the Pakistan case.
Thank you very much. So ours in Pakistan, this is the case of the Punjab province. And our starting point probably is slightly different than what Livia mentioned, because our starting point was more looking back 20 years of continuous support from the bank side, and trying to understand what is it that has been achieved over time. We knew the statistics. We knew that over time enrollment, for example, has increased. The gender gap in enrollment in basic education has improved a lot. But we wanted to kind of understand a little bit more on the dynamics on how this happened, and going down a little bit deeper than the big picture statistics. And fortunately, this was something that me and my co-TTL wanted to do in any case, because we were running the program, which is currently ongoing, ending December 2021. But there have been many projects before that. And when OPCS suggested, your team suggested that there's the potential to do kind of this deep understanding of the outcome orientation pilot in Punjab, we thought it was a great opportunity to kind of do this comprehensive analysis and go deeper into the background on where we started and where we are now. So for us, that was a great motivation to start. And what we had was the approach we took was a kind of a comprehensive approach, where we have the statistical analysis over time. We have really good data from 2000s to now. We have a lot of evidence coming out from the province of Punjab, quite a few studies that were done by the World Bank, supported by the World Bank. And in addition to that, we were asked to conduct interviews as well. So we had kind of this, triangulating the numbers with the interviews, with the, just to understand what was going on. And that's how we reached kind of a better understanding of where we are now and how we managed to get to that point. And what we found was throughout that there was evidence was being used to tweak what was going to happen in the next project. There was the research studies were being discussed with the government. The government was taking on board most of the ideas that we were discussing with them, evaluating it, and then being able to adopt it as policies. We started with the development policy loans in the early 2000s. We moved towards a disbursement linked indicator approach. In fact, it was one of the first projects in Punjab which adopted a disbursement linked indicator, which is now a PBC, and so on. So we really found a very rich background to what has been happening. So again, the line of sight, the long-term view was made quite evident to us through that study. And one of the issues that we did, although not much issues in the study overall, but one thing that we found a bit hard was to identify the right people to talk to from the government side who were still available to talk to, because it's been over time, there's a lot of turnover. Fortunately, we were able to find more of the bank side people to discuss this with, but from the government side, there were a limited number that we were able to find. I'll stop there for now.
Thank you, Tassin, for adding this view on this interesting case. Zubair, what about Kenya?
Sorry. Yeah, thank you very much, Lisandro. And I think our paths crossed a long time back in Bangladesh, and that was the time when the term results was so much trying to be ingrained in our brain that we were getting worried about the results thing altogether. But I'm sure the bank operations had gone a long way from that there to now, where results seems to be really the core focus in whatever we do in operations. So thank you for that initial introduction to results in Bangladesh portfolio back then. But very quickly, coming back to Kenya, Kenya has emerged as the leader in electrification in sub-Saharan Africa. And the amazing results that Kenya has achieved, we wanted to know through this study as to what were the factors responsible for that amazing success story. And that knowledge would really help us to get this replicated in other countries in sub-Saharan Africa that are struggling to get this electricity access scale up the way that Kenya did. So basically the purpose of that study was to really find out what were the factors, how the World Bank Group played the role that it did, and what were the factors that we could take to other countries to help the other countries move on the access scale up the same way as Kenya did. So basically the study, I won't get into the process itself, but the outcome that we got from the study was really, it very nicely summarized 4 key factors that World Bank Group contributed to that amazing success story in electricity access in Kenya. The one thing that we learned was that policy and institutional reform, policy, regulatory, institutional reform were so critical to that success story. And we all know that, but this study really documented that very nicely, that the unbundling of the sector, the privatization, introducing private sector participation in power generation, independent regulator to set the cost reflective tariff. These are the policy reform, regulatory reform that really help to create the foundation for a very good, solid access scale up. The other factor that was responsible was this concessional financing. Obviously, that's what we do, but really the concessional financing, the World Bank financing, going to the geothermal resource. Geothermal is the indigenous renewable energy source that Kenya has, and Kenya World Bank Group played the critical role to develop that geothermal resource initially, and then other donors came in to scale up that resource. And today, Kenya is 8th in the world in terms of geothermal capacity. So bank financing was critical to unlock this geothermal resource that was really the renewable energy source for power generation in the country. The third factor that came out also recently, and we all know that the continuing long-term engagement in institution building, which is continuing even today, that was also very critical for getting the access story. And last but not the least, this whole prioritization of electrification strategy in government policy documents, government's mindset, government's narratives was so critical to get them on a very on this access trajectory that the World Bank played a very critical role in that. We supported this national electrification strategy, which identified where grid should be going, the network should be going, where off-grid solar home systems and mini grids should be playing a role. So that strategy based on a geospatial tool helped the country to chart a path towards universal access through all the technology options. And that was a critical input that the World Bank played in this access story. So altogether, these 4 factors were really nicely summarized, and that really helps us a very good knowledge source for us to play the same critical role in other countries who are struggling with low access to electricity. Thank you very much.
Thank you so much, Zubair, Tassin, and Livia for setting the stage and presenting the main findings and the main methodology of the study. I'll ask colleagues to please let us know if they have questions and views, comments. I think we wanted this to be an interactive discussion, so you can put your comments on the chat and I will be reading them as they come. But maybe just as you start to do that, I wanted to ask the three of you, Livia, Tassin, Zubair, maybe starting with Livia, is there, if you were to isolate one key lesson, Livia, or one key piece of knowledge from your study that is influencing the way in which you are implementing or designing the program right now, what would that be?
Well, that's a very hard question, Lisandro. Because I mean, what we felt was that, you know, this work really, you know, had sort of the production function towards reducing malnutrition is very complicated, right? So one factor is very hard to pinpoint on. But let me just tell you that, to me, the issue of evidence-based, right? And I think that I've heard from my colleagues also, I mean, this is, to me, the critical thing, right? That we had the data and that, therefore, the honing in on our objective of the results was something that we could measure, okay? And that everybody was really looking at the data, trusting the data, and ensuring that we could also keep on gathering the intermediate indicators that we knew that were very, very clearly linked to the final objectives and the final results. So to me, that is, let's say, the one thing that we were able to do in Peru. And so let me just give you two bits of detail under that. One of the things that, you know, I had been working in Peru on and off for you know, on this topic for quite a while. And one of the key issues was that we could not follow a child. For many years, we could not follow a child. But when the nutrition program really started seriously, Peru had, with actually one of our DPLs, with support from one of our DPLs, instituted the fact that every child, when they were born, their birth certificate had an ID number that accompanies the person until their death. And so from that point on, we could follow the child along its life. It doesn't matter if the child moved from one place to the other. And so also the health, the clinical history for the child would move with the child. And that ended up making, I think, one of the most important factors, right? Because we could follow the child, and therefore the monitoring could go all the way down to the child level. Of course, as I say, there are very many other factors, but if you ask me to name one, I would say that this is the one.
This is very useful, Livia. I think, you know, clearly that's a very important ingredient of outcome orientation, being able to purposefully track the results over time that are connected to your high-level outcomes. So a very clear monitoring plan of the ultimate changes that we want to see with the program. I think this is very good. Tassin?
Yes, thank you. As Livia said, it's very hard to pinpoint on one thing, especially when we're looking on a 20 years time horizon approximately. And many things were done and many things failed, but that's exactly what we learned. We learned, can point to two or three things. One, very specifically, over time, we were also reviewing, you know, for Pakistan, other work that we had done for Pakistan. We were reviewing things and we realized that in Pakistan, a lot of the policies have already been tried. There's policies introduced and things not being achieved. And there was just something missing, you know, the good ideas that worked elsewhere, why were they not working in Pakistan? And when we started looking at this specific case in Punjab, we started realizing that a key reason why a lot of things were successful under this under the various series of projects that we were doing, or the World Bank engagement, which was then, just as a side note, was also enhanced and worked on by the FCDO, which is now, which was at that time DFID. They had a huge program in Punjab. And we supported each other. They built on ours, and then eventually they were quite a big partner there. But basically, the big thing was the monitoring system that was set up, and this was set up very early in 2000s under the World Bank's DPOs. There was a series of 3 DPOs, and the monitoring system did 2 main things. One was that it set up an agency, which was a Punjab Monitoring and the PMIU, the Monitoring and Implementation Unit, which is still to date ongoing. And it was something that was not a typical bank-supported project implementation unit, but it was something that was kind of embedded in the government system, so that once a project ends, people do not disperse, and you don't lose the experience. They were consistently there. They were there, obviously with the turnover, but that agency was able to implement the reforms, the various reforms that came in, whether it was the bank and then eventually other development partners coming in. They were the ones supporting it. And the other thing within that was another system of monitoring and evaluation specialists who were randomly sent to schools to see, what's happening on the schools, and that, again, an independent kind of group of people who can identify the area. So that was one big thing that we saw happening. The other one that I think was very important and an important lesson learned is that the value of having impact evaluations built in our interventions. And that was, we've had throughout. One of them was on public-private partnerships with schools in Punjab. We have for Sindh as well, but on Punjab, it was, as things were being rolled out and being developed, we were able to see the impact on the ground, whether enrollment was increasing, whether there was an impact on quality of education for children, and then those were strengthened or tapered off. So depending on what the results we were seeing, we would, the bank's team was actually working with the government to either introduce a policy or enhance it or remove it as the case may be, because there were obviously successes and failures. So these are the 2 key things that I think we did well, and the lessons that we took out eventually, and that's what we are taking to our next project, because there's another one in the pipeline now in Punjab, and we're taking all of those key lessons and into account. In fact, we're thinking of going back into construction, which is something of schools, which is something we hadn't looked at in many years in Punjab. So I think that I'll stop there for now, but happy to answer questions.
Thank you, Tassin. Very excellent points as well. I mean, you, like Livia, emphasized the importance of monitoring, but I think you added another dimension, which is the importance of learning as well, having a very clear plan to produce evidence of what works and what doesn't work towards the outcomes that you are trying to achieve. So the cases of the impact evaluations in Punjab, I think, is a very clear case of how that can be done in practice. Subair?
It's a struggle with my mute button, but for us, it was mostly there were different factors in play. I would say that for Kenya, so many things got into place in one together that the success story was achieved. And I think the main value, the one thing that we learned is that it's very easy to, in our day-to-day operation, to keep on doing what we are doing at the onset. Once we set the project goals and everything, the project represent document is written, then we just move on with implementation of the project. And it's very easy to lose sight of the fact of the longer term goal. And with staff rotation, with turnover in the team, with IRS staff which coming, joining, leaving the program, we do lose that knowledge. Somehow we don't capture what we had learned in the previous CPF and what could be incorporated well in the next CPF. There is an effort to do that lessons learned, but it's not that systematic. So somehow, I mean, this study has actually shown that over the last 10, 15 years of our involvement, all those factors we somehow knew were contributing, but now we have documented those factors, how they got into play. So I think that was a very critical thing that we are missing out even now in operations, that we do projects after projects, we do have CPFs, we do have lessons learned, but somehow it's not very systematic way of accumulating that knowledge and making sure somewhere that knowledge is there, and then that could be brought on in our next operations, next CPF. So unless this study actually showed that maybe we need to do these kind of studies on a more regular basis to really make sure that bank captures that knowledge, that involvement that we have been doing, the historical engagement, the context, and then we proceed with CPF after CPF and project after project. Thank you.
Thank you, Zubair. It looks like I have coordinated these responses, but I actually haven't. You didn't even know that I was asking the questions, but I think you added yet another important aspect of outcome orientation, in addition to monitoring and learning from evidence, creating spaces to reflect on progress and, do mid-course corrections whenever needed, with the eye on the high-level outcome and not necessarily all the time only on the short-term operational constraints and implementation issues, but really assessing your progress towards the ultimate results. So very good examples and reflections for the team at large. So there are a couple of questions that are very interesting in the chat, and I'll ask you to give us your thoughts. An important one that Livia emphasized at the beginning is the role of the clients. And here, the colleagues are asking, were the clients champions of results? Were they supporting this study? How did you involve them? So a little bit of a reflection on the role of the clients in all of this. Livia?
Sure. Yeah. To me, if there is no client commitment, you are not going anywhere, right? And one of the things that happened at that time was that with the change in government, we had prepared policy notes, and I don't want to attribute that the bank got the conversation going, but I think that the bank facilitated through the policy notes the issue of what were some of the key issues in the government of Peru, in the country, that needed to be focused on, right? So to me, that's one of the things, and that got the conversation going. But yes, there was a champion, right? So when this new government came in, they established a program called Crecer, which is in Spanish means to grow. And basically that unit, which was not sort of a formal unit, but it was a champion unit that actually we knew reported to the president, became extremely important at the beginning to bring all of the actors together, because as you know, with nutrition, it's not just health, right? I mean, you need the social assistance programs involved, you need the local governments involved, and of course you need the community involved. I mean, there's too many stakeholders. Having said that, it was great to have this champion at the beginning that was not necessarily an institution, but soon after that, a Ministry of Social Inclusion was created and the championship was institutionalized. And to us, that's what's allowed from an initial push for this topic to become a long-term push for this topic, because now it is part of an institution that is leading and that has it as one of the key indicators in their own performance.
Thank you, Livia. That is, again, very clear. And the old role of the champion, which I think is fundamental in pushing results on the long term, I think it's an important aspect to highlight. Tassim?
Yes, exactly as Livia said, it's critical to have that kind of champion, some champion or a group of people or someone high level who really supports the ideas. And for us, it was interesting because we found that out when we talked to the TTL from 2000, early 2000s and 2003, 2004 on how they developed the dialogue, because again, it was at that time it was a DPL. So for a DPO, you have a different kind of a dialogue. And we realized how strategically they were engaging various players, and the big picture they had in mind, and that's how they leveraged the fact that it was a DPO, was that it wasn't just the line ministry, the Ministry of Education. It was very much people in the Ministry of Finance, the planning division, the planning departments, and then the chief minister, and the line that goes to the chief minister in Punjab, which is kind of, you know, the head of the executive head, so to speak, of the province, and how that kind of that dialogue was being leveraged, and to make sure that the right policies are being introduced and being put, obviously, in the DPO. So we saw that we found that quite interesting, because, to be honest, in a way, since the last project, a couple of last projects have been, they're called like the first, second, and third phase. They're not really phases, but they're doing similar things as was being done before, just as I mentioned, tweaked after learning lessons. But the actual introduction of the big reform was in the early 2000s, and that's when the champions were kind of sought out from various ministries who had the authority to kind of allocate more funds to education, for example, who had the incentive to support, and then in throughout the 2010s, basically it was again at the highest level, the chief minister's level, where the education was being education projects were being discussed, outcomes were being discussed, and we were part of a bigger reform agenda. As mentioned before, also FCDO was there, and now again, we in our dialogue we always make sure we have discussions with the people who have the ability to make the change, and obviously sometimes it's difficult to bring your point across, and I mean, all of us have been in operations, so we know how that dialogue goes. But thank you.
Thanks, Tassina. I think what you're emphasizing is, some of the things we said at the beginning, the importance of these indirect pathways to achieve your results, understanding the political economy, the policy constraints, the need to build capacity, and that is as essential as the more direct service delivery, lending instruments that we use. So really combining that thinking on capacity and policies with investments has been essential in your case, and I think in all the cases. Subair?
I think initially, I mean, back in some years back, we used to really use this term champion for reform, right? And it's absolutely critical. We don't use that term anymore, but we do actively look for those champions in reform in the government side. And no matter what we do, we are not implementing the projects. It's government's projects, so they have to have the right champion. I think our case in Kenya case, the president of Kenya was we saw the value of having electricity access because he would be earning votes in his next election. So he said the tone that his government wants to achieve electricity access. Then it came down to the technical people to have that vision, turning that vision into reality. And I think that's where World Bank Group played the role, that helping the technical people to do what they needed to do. We had the experience in other countries. We basically sort of not hand-holding them, but sort of providing them with the right advice at the right time as to what is needed to do from their side to really get this electricity access done in the right manner. So I guess absolutely something, the role of the government, role of champion in the government side is absolutely critical. Once you have got that, then it's much more easier for us because we have done that in so many other places. It's our role then to really help them to do what they needed to do. Thanks.
Very good. Let me ask you, Subair, the next question. So I am fair and I give Livia some time to think about her answer. I have put her on the spot too often today. So one of the colleagues is asking, and I think it's a very interesting question, is there anything that you learned that the bank tried to do, but actually did not deliver very well, that it failed at delivering, or that it should have done differently than what it did?
That was a very tough question to put me on spot on. But I think it happens every now and then, right? For Kenya, for other countries that we have worked on. For Kenya, I think yes. One thing that really we were struggling initially was this, even the access numbers, grade numbers. I think there was a little bit of the way the access was measured was not really accurate, and it took a while for us to also acknowledge that issue, because when they were saying that they achieved 70% access, they were actually achieving only 50% access. So we never really got too much into this until it was very late in until very recently we started to look into the figures, and that's when we realized that actually access is not yet 70%. 70% access is both from grid and off-grid options, but government was claiming that they have achieved 70% grid access, which makes a big difference between grid and off-grid. I won't go into that, but I think if we had looked into the access figure itself more closely, we would have realized that government still has a little bit more way to go. But because that was not identified back then, now I talked about the president seeing the value of electricity access. Now he thinks that his mandate has been fulfilled. I mean, his objective has been fulfilled by having 70% access, and we are now struggling to let the government understand that 50% grid access is not enough. They need to go at least 85% access, and then the rest 15% should be off-grid to get to universal access. So because we took a little bit time to really look into the access methodology itself, the way they were measuring, they were counting 7 people per household, whereas it should have been, census were showing 4 or 5 people per household. So only now we are having this dialogue that, listen guys, you have done a lot, but still not there yet. So you have to keep on doing what you are doing. And that has been a struggle to get that focus back from the government side. So if there was one lesson learned, was that we really needed to look into the way they were measuring the access figure. So that could have been really useful if we did it earlier, but now we are doing that. So rectification, lessons learned, rectification being done.
Very important lesson, I think, about measurement. Tassim?
So I'll mention one area that I think in Punjab we tried over and over again, and we've eventually thought that it probably will not work the way we wanted to. So this is on school community engagement. And we have very successfully been supporting school-based budgets. These are called non-salary budgets because that's it really supports additional inputs that are needed at the school level for operational costs. And one of the things we wanted to go with it was that the school community becomes really involved, and they are the ones that are bringing much more value added to the dialogue. But in different in our different projects, we tried pilots. There was an impact evaluation at some point, and then there was some tweaking, and there was another pilot, and trying information sharing and so on. And even in this current pilot, we tried to bring in many more people in the school committee from the community. And that's, we're trying to use videos and app-based approaches, and bringing in technology this time. But we've finally figured out that it's just a bit too hard to get the whole community engaged in school, and there needs to be some other way of making sure that it's still working fine in terms of the expenditure of the non-salary budgets, but engaging the community has been hard. So in fact, we recently, 2 weeks ago, had our concept note for the next project in Punjab. And one of the things we explicitly decided to drop was community engagement explicitly in this way. maybe we can do some other way of motivating parents or motivating the community to send children to school. But the way we had envisioned it before, we explicitly actually decided with the country director's blessing to kind of drop this idea and not go on with it in the next phase.
Excellent. Livia, on your side?
This work on nutrition, you would imagine that the health sector was the champion, right? But the interesting thing about this whole work was that it was really led more by actually on the bank side by the social protection team, and the championship was developed by the social protection areas of the government. Okay, at that point it was sort of spread out until they created the ministry. And so, the question we kept on asking ourselves after when we were doing the final analysis was, why was it so hard to work with the Ministry of Health? And it is true, and we found that the Ministry of Health is maybe the most territorial institution of those that we were involved with, right? The other ones understood that you needed to work with other parties in order to get results. But with the Ministry of Health, the work that they had done on maternal mortality, which had been extremely successful, was a one-stop shop type of an effort. And this couldn't be a one-stop shop type effort. Of course, how did we resolve it? We resolved it by working with the regional health directorates, which are somewhat autonomous, even if Peru is not a federal country. And they were super involved because they realized that they had a role in this. And then the Ministry of Health sort of got involved when they realized that the regional directorates were doing the work that they should have been coordinating. But the question we keep on asking ourselves is, what could we have done to improve the relationship with Ministry of Health and communicate better the need for their much stronger involvement from the beginning? And so to me, the lesson on this one is, of course, some ministries are very much hung up on their old ways, let's say, and it is very difficult for them to work outside the box, especially ministries that are used to working on evidence-based, and they feel that they have control over all of the factors that lead to the results. So to me, this was, it's still one of the little stones in our shoes, let's say, from that process.
Very good, very insightful, Livia. I hope our colleagues from IG don't notice that when I asked you to talk about one success, you all complain, but when I talked about one failure, you were all very disciplined and you selected one. So I think it's an interesting fact. Let me ask now, it's not on the panel, but I wanted to ask my colleague Karima Saleh, who actually coordinated these pilots, to see if she wants to add, some thoughts on some of the lessons that we learned in comparing all these studies. Karima, are you there?
Yes, I'm here. Thanks so much, Lisandro, for the opportunity to say a few words. And I think this panel was so fabulous because you asked them questions to focus on things of M&E and as well as some failures and what are some lessons learned. So I just found this panel so interesting, despite the fact that I was involved with them on the case studies. So I just wanted to briefly just mention the key lessons that we have heard today from the panel, which I think are takeaways for us. First, I want to just mention that the World Bank Group views outcome orientation as a continuous focus in all its public and private development activities on helping the poor and vulnerable people improve their well-being to realize their full potential. And so our efforts are not just at the bank side, but also IFC and MEGA side as we partner with them in this effort. The 4 ingredients that we got out of today's panel was 1, learning and evidence. That typically the bank tests development solutions before they are brought to scale and builds learning opportunities into programs. That came out very clearly in all three speakers' discussions. The second is pathways, that the bank interventions weave instruments in infrastructure and service delivery, direct pathways with support to strengthen institutions and create markets, the indirect pathways. And as we heard from everybody, that the long-term vision of institutional strengthening goes beyond CPF cycles and having critical elements, and the policy dialogue doesn't start off well, it doesn't end up well. Adaptations. The bank continuously recalibrates interventions in response to risks to the desired outcome and uses evidence to adjust the strategic approach. The impact evaluation and the monitoring systems that were developed in Peru, Pakistan, etc., were critical to bring about the corrective actions that were needed as the program developed. And finally, program of support, that the bank contributes to high-level outcomes are delivered through an integrated package of financing and analytical, advisory, and diagnostic services over time, typically which are over multiple CPF cycles. And I just want to I want to emphasize here the points that mentioned everybody, the championship of the government. The demand has to be driven by the government, and that demand is driven by the evidence that we bring, the knowledge that we disseminate to them to change their thinking, to bring about the reforms in the policy. So thanks so much again, Lisandro. Over to you.
Thank you very much, Karima, for those remarks. I think what I wanted to say as we approach the time limit of this conversation is you have to stay tuned in the next few weeks or days. OPCS will be issuing revised CPF guidance that builds very much on the lessons from these pilots and also on the lessons from the IG evaluation of outcome orientation at the country level. And this revised guidance, I saw there were questions about the CLR, will hopefully be very clear in suggesting the way forward to track outcomes better. The first thing that they will do is making sure that we have in the CPF a very clear identification of a few selected high-level outcomes that the program aims to achieve over the long term and clearly articulate that in the CPF. I think it's important, as Livia, Tassin, Zubair said, to keep the clear line of sight with the ultimate results that over the years, through direct and indirect pathways, the programs are going to achieve. I think the second principle that is reflected in those guidelines is about learning from the past. And this is very concretely elevating the CLR as an opportunity to reflect on the achievement and the progress towards those outcomes and discuss it earlier so that it becomes an integral part of the design of new programs. Very often this is a secondary consideration when we discuss the new CPS, but bringing it a little bit forward so that it becomes an integral part of what we do. And finally, I think a very core principle is trying to carve space in the implementation of the country strategy to reflect, as Zubair was emphasizing, on progress towards the outcomes and making mid-course corrections whenever needed and as often as needed to keep the pathway to the ultimate results that we want to deliver on. So many of these or all of these principles are going to be reflected in this guidance with very concrete suggestions on how to move forward on that. So stay tuned for that, particularly all of those colleagues that are preparing right now CPFs that will be discussed next fiscal year. Yelena, before giving the floor to you, I just want to give the floor back to the panelists for 15 seconds. And I want to ask them to give me a tweet. If they were to tweet right now, anything that is that summarizes this discussion and the work that they have done, what would that be? So a sentence or two. Tassin, I will start with you.
You picked the worst person because I don't tweet. But that always we should always learn from the past, and that I think Zubair said it really well in when he was speaking about it. that we come in and we start looking at what we have right now or at the future. We don't understand what we build on, and that's very critical in you know, especially in the continuous work we do with the various governments. Thank you.
Now you have tweeted. Subair?
Tweet. I don't have Facebook account even, but I will give it a try. I would say the World Bank Group brings light to people, and we know how to do it.
Terrific. Livia?
I would say watch out for the indirect pathways, which I think in many ways is where the bank has impact. And working in a middle-income country where our clients do not necessarily need our financing, but desperately need our technical assistance, indirect pathways become extremely important in achieving outcomes.
Thank you. I think you've been tweeting for a while, Livia. I can
No, I own a tweet account only to follow some other colleagues, but I'm exactly where Tassim is.
Thank you very much, colleagues. It's been a great conversation, and I hope you enjoyed it as much as I did. And I give you back the floor, Elena, for closing the session.
Thank you very much. And thanks a lot to everyone for this lively and engaging discussion. I think, you know, what I like the most about this session is that it is a truly knowledge sharing session, because it's very important to hear from people who are on the ground, right? Who do real work, who are on the front line, how they pursue these pilots and what are the lessons learned, because that will help all of us who are, like Lisandro said, working on the new CPFs or other country engagement products in the future to shape up the content. I also wanted to thank Lisandro personally. Thank you very much for moderating this challenging discussion. Thanks a lot to the panelists who joined, and big thanks to our PCS team who did not only join, but also try to provide some guidance in the chat box. So thanks a lot to Peter, Kamal, and Karima. I know that people are dropping from the call, but before you leave, please take our brief survey, because we really need your feedback to understand, you know, how we're doing and what do you think of today's session. You can use your phone either to read the QR code, which I did not see whether it was provided, but there is several times when Patricia posted a link in the chat box. So please click on the link and answer the questions. As always, all recordings of our course learning and knowledge sharing sessions are available on the course community website, which I hope the address by now you know by heart. And they're also available in the OLC. We will share the links with you in the follow-up email as well. And again, you know, big thanks to you, our participants of the sessions who joined despite the busiest time of the year. Goodbye for now, and hope to see all of you in July. Thanks a lot.